Hello viewer, myself Nupur Jadhao, Assistant Professor at Electrotherapy and Electrodiagnosis Department at Sancheti Institute for Orthopaedic and Rehabilitation, College of Physiotherapy. Today, we are going to see a newer technique, integrated neuromuscular inhibition technique. So, today we are going to learn about integrated neuromuscular inhibition technique, also known as INIT. The efficiency of INIT in the management of individual with trigger point is reported. So, what are the trigger points? Trigger points are painful spot formed in the taut band of muscle that becomes hyperirritable points forming which are irritable causing pain. This trigger point are developed as a result of overuse, mechanical pressure overload, psychological distress, and poor posture. Literature have found that trigger points in muscle can not only cause a chronic pain or worsen the condition, but also by limiting the range of motion, it can alter the biomechanics of specific joints. Now, what does INIT consist of? So, integrated neuromuscular inhibition technique consists of ischemic compression. Second is muscle energy technique. And third is strain counter strain technique. So, Chitos described it as INIT as a sequence in which, after location of a trigger point, this receives an ischemic compression, MET, followed by strain counter strain technique. So, this method helps to relieve pain and muscle function. Technique can help to achieve muscle relaxation, reduce tension, and improve neuromuscular efficiency. It was suggestive of decrease in pain intensity, increase in function and range of motion due to the increased blood flow by intermediate pressure, tone or tension reduction in a muscle by MET, and muscle relaxation by strain counter strain technique. So now let's see how trigger points are formed. So as we have seen before, trigger points are painful spot formed in a taut band of muscle that become hyperirritable causing pain. So trigger points are formed as a local contraction in a small number of muscle fibers in large muscle. The integrated hypothesis theory states that trigger point form from the excessive release of acetylcholine, which in produce sustained depolarization of muscle fibers, resulting in the shortening of sarcomere length. After sarcomere shortening, whenever muscles move, more blood flows and oxygen supply is needed to maintain the normal functioning, which further aggravates the ischemia and hypoxia. Trigger point includes pain because of release of inflammatory factors containing substance P or interleukins like 6, that is interleukin 6. So this is the trigger point. So these are the taut muscle band. So the active trigger points looks like this, and these are the normal muscle fibers. So basically trigger points are in the shorter state. Sarcomere in this area are shorter. Now, what are the indications for INIT? So first, myofascial trigger point. It could be active trigger point or latent trigger point. Second, acute and chronic musculoskeletal pain. Third could be muscular tightness and reduced range of motion because of specific muscle. Contraindications are acute inflammation or infection, fractures, skin condition or open wound, blood clotting disorder, and recent surgery with incision. Moving ahead. So now let's understand the mechanism behind every single technique used in integrated approach. So first, ischemic compression. So ischemic compression is a manual technique to relieve pain and muscle tension by applying a sustained pressure to a specific point in muscle, that is a trigger point. Technique aims to temporarily reduce a blood flow, that is to create ischemia to a target area, which can reduce muscle knots and decrease pain. This may result from an active hyperrhythmia producing in the area, that is increase in the temperature, and from inhibiting the spinal reflex mechanism. Now let's move on to a second technique, that is muscle energy technique. Post-isometric relaxation technique is used. So MET is a common utilized method for achieving tension release, that is inhibition in muscle. So this technique uses patient's own muscle contraction against the control counterforce applied by a therapist. The approach involves an isometric relaxation through the influence of Golgi tendon organ autogenic inhibition. That is, it is a reflex that reduces muscle activity when it produces dangerous high tension. So let's deep into a basic little. So what is Golgi tendon organ? So GTO are located in outside the muscle in the tendon where it attached to a muscle. So GTO monitors muscle tension and signal it to an interneuron which initiate autogenic inhibition. So autogenic inhibition regulates the frequency of discharge, range of firing of motor neurons, and relaxation of gamma and alpha motor neurons. So benefit of Golgi tendon apparatus is that autogenic inhibition can help reduce muscle splinting, which can be caused by somatic or visceral trauma. So MET is based on your autogenic inhibition. Now next technique. So next technique is strain counter strain technique or positional release. So strain counter strain is a manual technique used to reduce pain and muscle tension by placing the body in the position of comfort to release the tension in the affected tissue or a muscle. This method was developed by Dr. Lawrence. So according to him, when there is an injury, body responds to it with a strain or tear, or it could be tightness. This tightness is protective, that is, muscle goes into a shortened position to avoid any further movement to prevent injury. This protective impulses comes from a brain. When muscle is contracted, there is reduction in a blood supply and lack of muscle use due to a fear, and the muscle is neglected. So strain, when a strain or an injuries happens, we counter this injury by finding the position that is sent to a brain in which muscle could be relaxed, or message is sent to a brain that muscle can be used gently without further injury. That is negotiating with your brain. Strain counter strain technique is usually used in combination of trigger point release with a slight pressure. Okay. Moving ahead with each technique, how are they carried out? So first come is an ischemic compression. So basically we identify a trigger point through palpation and patient's feedback in a particular muscle which is restricting the range of motion. We will be looking this with an example. Application of pressure could be like 30 seconds to 2 minutes, and then we release the muscle and reassess it again. Okay. So steps of ischemic compression. First, assessment. So therapists identify the trigger point or the tight area in the muscle by palpating with the help of knuckle or thumb. Now let's consider one example, that is tightness or trigger point, active trigger points in your gastrosoleus muscle, that is your calf muscle, leading to decreased range of motion of ankle dorsiflexion or giving rise to an heel pain. So when we can use INIT in this example also. So ischemic compression is takes in the following step. let's assist. So we will ask the patient to lie prone or in sideline, whichever is comfortable for patient. We will assist for a trigger point, find out the trigger point. So second positioning, place the patient in comfortable position. Then application of pressure. So use of thumb, fingers, knuckle to apply direct pressure to a trigger point. Increase the pressure gradually until the patient feel mild to moderate discomfortable. When he is discomfort, aim is to reach a point where the muscle begins to relax. So for gastrocnemius muscle or a soleus calf muscle in general, we can hold in our fingers and between our thumb, and we can apply deep pressure and maintain that pressure to release. And once after 30 seconds to 2 minutes, we go for relaxation. After reassessing the releasing the pressure, reassess the trigger point. So what are the benefits of ischemic compression? So first is pain relief, the mechanism what we have seen earlier. Second would be decrease muscle tension, and third will be improved range of motion. So in example of calf muscle, it would decrease your heel pain or a trigger point pain. It will help to elongate your muscle and relax the tension within the muscle and improve the ankle dorsiflexion range of motion, as we can see in picture also. So before trigger ischemic compression for trigger point in calf muscle and after. So pain relief helps reduce pain associated with trigger point. After the releasing the pressure, blood flow returns to the area, bringing out oxygen and nutrition that helps healing process and reduce muscle tightness. Now, what consideration or precaution you should take while doing this technique is always ensure the pressure apply is within the patient's tolerance to avoid causing excessive pain. And second would be start with a light pressure and gradually increase to a desired level to maintain patient's comfort again. Now moving ahead. So our next technique is muscle energy technique, MET, that is post-isometric relaxation. So volunteer muscle contraction, control counter force, and gentle stretching. So to treat musculoskeletal is a function by using the patient's own muscle contraction against the control counter force applied by a therapist. Post-isometric relaxation technique is used, that is autogenic inhibition, that we have seen through Golgi tendon apparatus. So when muscle contracts and then relax, the Golgi tendon organ and the muscle sense the tension and the signal the muscle to relax. This allows the muscle to stretch more deeply and effectively. So the principle of post-isometric relaxation is voluntary muscle contraction. The patients actively contract their muscles or muscle group against the resistance provided by the therapist. Counterforce, control counterforce that match the patient's effort, ensuring the contraction is isometric, meaning the muscle doesn't change its length. And gentle stretching. So following the muscle contraction, the muscle stretch to a new length, length repetition and relaxation. The technique is typically involves repetition with a brief of relation between each counterforce stretch. So let's see the steps in MET. So again, it will be assessment. The therapist assists the patient to identify the dysfunction such as reduced range of motion or muscle tightness. So if we take an example, previous example, that is a calf muscle tightness leading to an heel pain. Now here the therapist will assess the range of motion of ankle dorsiflexion with a goniometer. Now Positioning, the patient is positioned comfortably and the affected muscle or a joint is taken into an initial point of restriction. So for here, you can apply MAT, that is post-isometric relaxation. Patient is lying supine with knee extended for your gastrocnemius muscle and knee flex with the soleus muscle and resisting your ankle plantar flexion for gastrocnemius muscle. So patient's contract. Third step will be patient's contraction. The patient is instructed to gently contract the target muscle with 20% of their maximum efforts against the therapist resistance. So this contraction is held for 5 to 10 seconds and the muscle is relaxed and taken into a new range of motion. So that is increasing your dorsiflexion. And fourth step is relaxation. The patient is asked to relax the muscle completely after relaxation. Therapist gently stretch the muscle to a newer barrier. So the muscle to a new barrier, this process repeats for 3 to 5 times, each time stretching a bit further until optimal lengthening of muscle or range of motion is achieved. So in our case, it will be the lengthening of calf muscle, increasing your ankle dorsiflexion range of motion. Again, the consideration would be ensure the patient is comfortable and the contractions are within their pain tolerance. And second, the increase the stretch gradually to avoid overstretching and causing any discomfort to the patient. Now moving ahead, the next technique is strain counter strain technique. So this technique is used to alleviate pain and muscle tension by placing the body in a position of comfort to release the tension in affected tissue. Okay. So assessment, again, the therapist identify the trigger point. In our case, it is a calf muscle. Second will be positioning. The therapist move the body, a patient's body or a limb into position where the tender point is less painful or the muscle feel more relaxed. So this is called as position of ease. The therapist move the patient's limb into less painful area. Holding the position, the the position of ease is held for a specific duration, usually between 90 seconds to 3 minutes. So in our case, for gastrocnemius and soleus muscle, this is the position of ease, where your calf muscle is completely relaxed. So it is a knee flexion. So patient is lying in prone with knee flexion and ankle plantar flex. So your calf muscle is completely in the position of ease. Sometime in this position, you can even release a trigger point. So this position and this position of ease is the part of your strain counter strain technique. So you are relaxing your muscle. And lastly, relaxation. After holding the position, therapist gently and slowly return to the body part to its neutral position. So after holding it for 90 to 3 minutes, again we can come back to neutral position. So gentle return after holding the position, therapist gently and slowly returns to a body part to a neutral. This is done carefully to avoid reactivating the muscle tension, and reassessment is done. The therapist reassessment that the tenderness of a point has been reduced. So the conditions that can treat with the help of integrated neuromuscular inhibition techniques are chronic headache, low back pain, neck pain, heel pain, or hip pain. So they are related as trigger points in your upper trapezius muscles or piriformis, gastrosoleus muscle. So this will help to release the pain from a trigger point in and followed by a muscle relaxation. So these are the studies and literature and published paper in which INIT has been used. So it was for upper traps. So rotations and side flexions of neck has been improved. Next study was done on piriformis muscle, that is trigger point and tightness in piriformis muscle, which on release of trigger point and tightness with the help of INITs have improved their hip range of motion, and gastrocnemius muscle, that is a calf muscle, so improve ankle dorsiflexion range of motion. That's it from my end. I thank PhysioTV, Apurva Shimpi sir, Manisha Sangvi ma'am, and Parag Sancheti sir for giving me this opportunity to conduct a class on PhysioTV. Thank you.